All right, let's look at the bones of the forearm or the radius and ulna, and also the bones of the hand. So, starting with the ulna, which is on the medial side or your pinky side, and the radius is on the lateral side or your thumb side. So, we have the olecranon process. We also have the trochlear notch and the coronoid process. And the olecranon process, the trochlear notch, and the coronoid process kind of create a semicircle that articulates around the trochlea of the humerus. On the anterior side, we have the radial notch, on the lateral side, and this notch is where the radial head articulates at the radial ulnar joint with the ulna. On the anterior side, we have the ulnar tuberosity. Distal, we have the ulnar head with the ulnar styloid. Between these two bones, keeping them together, is the antebrachial interosseous membrane. So that's indicated with the number 9. Looking at the radius, we have the radial head that articulates with the ulna. We have the radial tuberosity on the anterior side. Then distally, we have the styloid process and the ulnar notch. So the ulnar notch articulates with the ulnar head at the distal radial ulnar joint. Looking at the hand. So we have the dorsal view and the palmar view. So the dorsal is the back of your hand. Palmar view is the palm side of your hand. Remember, the radial side is your thumb side, ulnar side is your pinky side. So first, we have the carpals, which are 8 bones that you can kind of palpate. They only do glide in between these bones. One is called, and we can look at them as proximal row and distal row. So the scaphoid, the lunate, and the triquetrum are on the proximal line of the carpals. And then on top of the triquetrum, you have the pisiform on the ulnar side. And if you palpate, it's the bone sticking out and you can kind of move it around. The more distal line of carpal bones is the trapezium. I remember the trapezium under the thumb. So that's on the radial side. Then we have the trapezoid, the capitate, and the hamate. Some people remember this, and if you have other acronyms or ways to remember, please share. It's as some lovers try positions that they can't handle. So those are the first letters of all the carpal bones. The metacarpals are long bones and they're actually within your palm. So they're the 5 bones that you can palpate within your palm. So you have from radial to ulnar, you have 5 metacarpals. And then we have our phalanges. We have 3 phalanges for each digit, except for the thumb. And so we have 14 phalanges. So we have the proximal phalanges, 1, 2, 3, 4, and 5. Then we have the middle phalanges, which are 4, 6, 7, 8, and 9. And then the distal phalanges, which are on the thumb because it doesn't have a middle, index finger, middle finger, ring finger, and pinky.